All right, let's get into it. We usually think of diseases as something that invades our bodies from the outside. But today we're looking at something totally different. It's more like an architectural problem. We're going to explore what happens when the very blueprint for the heart has a flaw, right from the very beginning.
So that's really the core question here. I want you to imagine the heart as this perfectly designed house. It's got plumbing, it's got electrical systems, and everything needs to work just right. But what happens when the original plans, the blueprint itself, has a mistake in it?
Before we can really dig into the flaws, we have to appreciate the perfect design. So how is this thing supposed to work anyway?
When it's working right, it's this incredibly elegant and surprisingly simple circuit. The right side of your heart takes in all the used-up blue blood from your body and whoosh, pumps it over to the lungs to get a fresh tank of oxygen. Then, that fresh, bright red blood comes back to the left side, which is the power pump, that sends it out to the rest of the body. Two sides, two jobs, one perfect continuous loop.
Okay, so that's the ideal. Now let's look at what happens when that perfect blueprint is altered, right from the start, before birth.
So what do we actually mean when we say congenital heart disease? Well, the official definition is right here. It's a structural problem with the heart or its main vessels that's been there since day one. Just think of it like a construction error in the heart itself.
So where do these flaws come from? Well, here's the tricky part. For most cases, we honestly don't know the exact cause. We've identified some risk factors for sure. Things like chromosomal issues or specific genetic defects can do it. Even environmental stuff, like if the mother gets rubella during pregnancy. But most of the time, it seems to be a really complex cocktail of both genetics and the environment.
Now, a whole bunch of these blueprint flaws create a very specific kind of problem called a shunt. The easiest way to think about it? It's like a leak in the heart's plumbing.
So a shunt is basically a hole or a connection that just shouldn't exist. It lets blood take a shortcut, a detour, flowing where it's not supposed to go. And that completely messes up that perfect circuit we were just talking about.
And this is where it gets really fascinating, because which way that blood leaks makes a huge difference. If the leak goes from the high-pressure left side to the low-pressure right side, you've got oxygen-rich red blood pointlessly going back to the lungs. This overloads the right side of the heart, making it work way too hard. But the baby looks fine. They're pink. That's why we call it acyanotic. But if the leak goes the other way, from right to left, then you've got blue blood skipping the lungs entirely and getting pumped straight out to the body. The baby isn't getting enough oxygen, and their skin gets a bluish tint. That's called cyanosis, and it's a huge immediate red flag.
But here is the major twist in the story. That first problem, the overload one, that seems less serious at first, over time, it can dramatically flip and become something way more dangerous.
Yep, this whole process is sometimes called cyanosis tardive, which is just French for late cyanosis. It's kind of like a slow-motion disaster. It starts with that left-to-right leak. For years, maybe even decades, the right side of the heart and the lungs are just getting hammered by all this extra blood flow. Eventually, the blood vessels in the lungs get damaged, and the pressure starts to build up. That's pulmonary hypertension. The pressure gets so high on the right side that it eventually becomes even higher than the left side. And when that happens, the unthinkable occurs. The flow through that hole reverses, it flips. Now, blue blood starts flowing to the body, and a person who is perfectly pink for their whole life suddenly becomes blue.
Okay, so now that we've got the basic principles down, let's see how this all plays out in three specific and very different blueprint flaws.
First up, we've got the most common congenital heart defect there is, the ventricular septal defect, or VSD. It's literally just a hole in the wall between the two main pumping chambers of the heart. So this VSD is the textbook example of a left-to-right shunt. High-pressure red blood leaks from the left side to the right, forcing that right ventricle to work way, way harder. Over time, the muscle on that side gets thick and beefy. That's called hypertrophy. And if that hole is big enough and you don't fix it, it is the perfect setup for that scary reversal we just talked about, leading to late cyanosis down the road.
And it's not just the bottom chambers either. You can get holes in the wall between the upper chambers too. That's an atrial septal defect. And just to show you how even a simple flaw kind of layers, there are actually different kinds depending on where exactly the hole is. You can see here, one type, the ostium secundum, makes up a whopping 90% of them.
Okay, let's level up the complexity. This one is Tetralogy of Fallot, or TOF, and it's the most common reason for a baby to be cyanotic, or blue. The tetralogy part means 4, and that's because it's not just one flaw, it's 4 different problems all happening at once. You've got a VSD, you have an aorta that's shifted out of place, you've got a blockage to the lungs, and of course, a thickened right ventricle from all the strain.
All 4 of those problems team up to create a right-to-left shunt.
That blockage basically makes it easier for blue blood to just cross through the hole and go straight out the misplaced aorta to the body. That's why babies with TOF are blue from birth. And all that hard work the right ventricle is doing gives the heart a very classic boot shape on an X-ray. It's a dead giveaway for doctors.
All right, we've seen leaks, we've seen blockages, but for our last example, we're talking about something else entirely. This is pretty much the ultimate faulty wiring problem.
This is called transposition of the great arteries, or TGA, and it means exactly what it sounds like. The two main arteries leaving the heart are swapped. The aorta is connected to the right side, and the pulmonary artery is connected to the left. What you get are two totally separate circuits that never mix. Blue blood goes from the body to the heart and right back to the body. Red blood goes from the lungs to the heart and right back to the lungs.
Now, this setup should be instantly fatal. You can't live like this. But here's the most incredible, mind-bending paradox in all of this. The only way a baby can survive, even for a short time, is if they also have another defect. They need a shunt, a VSD, an ASD, something, to act as a bridge to allow some of that red and blue blood to mix. It's a flaw saving a life from an even bigger flaw.
This quote from the source material just says it all, doesn't it? It's a condition that's incompatible with life, but the very problem we started with, the shunt, is what makes it compatible, what gives doctors a window to intervene. It's just incredible.
So when you boil it all down, whether we're talking about a simple leak, a complex four-part flaw, or a complete and total rewiring of the system, all of these blueprint problems disrupt that one single vital pattern, getting the blue blood to the lungs and the red blood to the body.
And that kind of leaves us with a final thought to chew on. We've seen just how catastrophic these flaws in the blueprint can be, but we've also seen how the body can find these incredible, almost unbelievable workarounds to survive. So if the heart's design is so precise and so critical, what does its ability to adapt to even these kinds of profound flaws tell us about the nature of resilience itself?